Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Lagos State Government to plant trees for ecosystem recovery and better COVID-19 fight. Benue State Government to inaugurate first molecular testing laboratory to get relief from exporting samples within a month. And opposition leader Keir Starmer brands virus mutation Johnson variant over British government's plan to ease lockdown later in the month despite dire COVID-19 case projections. According to the World Health Organization, coronavirus infections have been on the rise in 22 countries of the Eastern Mediterranean region after 2 months of steady decline because of increased international travel, low protection and limited vaccination. The region, which includes the Gulf, North African and Asian countries, has registered over 11 million infections and over 220,000 deaths since last year. Iran has been the worst impacted by the pandemic, followed by Iraq. Ahmed Al-Madari, regional director of the WHO, says another spike is likely in the summer months as countries struggle to keep their borders open and their economies active. This is because various factors, including the detection of the Delta variant in 13 out of the 22 countries and limited distributions of vaccines. Meanwhile, despite efforts to contain the virus in Nigeria, 91 new cases have been reported across 8 states, putting the total confirmed figures at 168,000.
COVID-19 is firstly spread through respiratory droplets when an infected person coughs, sneezes or talks, and the use of face masks correctly in public spaces helps to protect one from possible infection. The Nigeria Center for Disease Control is encouraging the appropriate use, storage, and cleaning or disposal of fabric face masks to make them as effective as possible. According to the NCDC, daily infections rose in the last 24-hour cycle as the agency announced 91 new cases reported from 7 states and the FCT. Lagos was the most impacted state with 66 new cases, followed by Kwara State with 12 cases. Rivers recorded 4 cases, and 3 cases were recorded in Kaduna and Oyo State, while Ekiti, Plateau, and the FCT had 1 case each. The latest update includes data reported from Kaduna State for the 5th of July and 0 cases from Sokoto and Kaduna States. The total number of confirmed cases now stands at 168,000. 5 people have been discharged after testing negative to the virus, raising the total number of recoveries to 164,405. There were no casualties in the last 24 hours, leaving the fatality toll at 2,122. Presently, there are 1,473 active cases in the country, while over 2.3 million samples have been tested so far. The latest update by the National Primary Healthcare Development Agency shows that more than 2.5 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while over 1.3 million of those vaccinated with the first dose have now received their second dose. Lagos State has taken the lead as it has now vaccinated more than half of its eligible population, followed by the FCT, Kano, Kaduna, and Oyo State. In Africa, there are over 5.6 million confirmed cases of COVID-19 and more than 146,000 deaths on the continent. More than 76% of vaccines supplied have now been administered across countries in Africa. Across the world, there are more than 184 million confirmed cases, while deaths are getting close to 4 million.
A computation of the Climate Change Vulnerability Index identified Lagos State as one of the top 10 global cities and only city in Africa with high risk from climate change. In addressing such situation and reducing the spread of communicable diseases such as COVID-19, the Lagos State government is advocating tree planting to help produce oxygen that will keep residents healthy. According to the General Manager, Lagos State Parks and Gardens Agency, the tree planting day, which is slated for the 14th of July, is an initiative aimed at recovery and restoration of the ecosystem.
Last year, in light of the COVID-19 pandemic, we planted trees for life in honor of our health workers and frontline heroes. The devastation that followed the COVID-19 pandemic at its peak last year and the current realities encourages us even more to accelerate global physical environment restoration efforts. In fact, the United Nations, having declared years 2021 to 2023 as the decade on ecosystem restoration, is building a global movement to ramp up restoration efforts and put the world back on track to achieve global goals for a sustainable future, as failure to care for the environment will hasten the end of the human race. Tree planting is still one of the cheapest nature-based climate solutions that would also contribute towards the lasting COVID-19 recovery.
Away from Lagos, Akwa Ibom State has till date recorded over 1,900 confirmed COVID-19 cases since the first index case was reported in the state. The Commissioner for Health, Professor Augustine Umo, also says the number of recoveries indicates about 99% recovery. He was speaking to Channels Television in Uyo, the Akwa Ibom State capital.
I must say that the COVID-19 pandemic is still...
Professor Moore disclosed that the state has so far received a total of 69,030 doses of AstraZeneca vaccine, while 66,166 doses of the vaccine were successfully administered, describing the exercise as largely successful. According to him, although the people's initial response to the vaccine was not encouraging, the situation has since changed in favor of the vaccine as people now take it voluntarily.
We've utilized effectively 68,066 doses, leaving just a total of about 364 doses out of this. So you tell me, would you really say that the response has been very poor? I don't think so. Right now, on daily basis, I receive calls from people requesting to know where they can go to get their vaccines. And while we encourage more of the persons who took the first dose to come for their second doses, we also do still give out to those who come out for the first dose.
Some residents also speak to Channels Television on the level of public compliance with COVID-19 protocol.
I'm here with my first mask. I just came out from exams, so I now remove it. It's there in my bag. So if I want to talk to anybody now, I can use it.
Pandemic is no longer there, probably it's going down, so I don't think it's necessary I should use face mask again. So I'll stop using it for some time now.
Are you sure you're safe without it?
Yes, I am. I observe my physical social distance, and I think I'm okay.
The Commissioner cautioned against non-observance of the approved guidelines and protocol, as negligence could expose the people to danger.
In Benue, the state government says the COVID-19 and other infectious diseases testing center will be ready for use in 4 weeks following the approval of additional 150 million naira to upgrade and turn around the facility at the Benue State University Teaching Hospital, which serves as the treatment center. Governor Samuel Otom, inspecting key projects in the health and education sector, was particularly pleased with work done on the molecular testing laboratory located at the state's epidemiological center, just opposite the teaching hospital, which serves as the treatment center.
Activities are picking up at the State Epidemiological Center, where the Benue State government has just completed the construction of a molecular testing center for COVID-19 and other infectious diseases.
There has to be an inner fence covering this lab. This lab will be used for COVID activities, Lassa fever, and other related diseases that may be required to test. So in a month's time, this facility will be put to use.
After the inspection here, the governor engages traders and artisans along the university gates just beside the molecular lab and encourages them to live ready for COVID-19 by complying with all known non-pharmaceutical preventive measures. The Strait Treatment Center, located inside the University Teaching Hospital, cannot hold a candle to the new building, but the government says that will soon be fixed.
here is the treatment center, which is totally different from the laboratory, which is only to test to see if somebody has the infection or not.
We are committed to uplifting the structures here, and we have approved and set aside the sum of 150 million naira to be used for these projects.
Up until now, COVID-19 samples had to be taken to Abuja for testing, as Benue did not have the capacity. But with the new testing center, government is confident of analyzing its samples within a month.
Dr. Bem Ageda, Executive Secretary, Benue State Primary Healthcare Board, joins us now from the state capital via Zoom for more on flattening the curve in the state. Thank you for joining us on the program.
Thank you very much. You're welcome.
All right, tell us, is fatigue setting in Benue State in your assessment with regards to the NPIs, and tell us about the level of vaccination?
Thank you very much. We imbibed the culture of the vaccination as soon as we discovered the vaccine was available. It was made available to us in Benue State. We received in March. We received 73,150 doses. We subsequently had an addition of 22,260 doses. So the total number of doses we have received in Benue is 99,400. And immediately we swung into action. A lot of publicity was given, social mobilization, getting people to come out. Of course, it was voluntary for people to come out. And we had the first phase where we concentrated on health workers, and subsequently it was expanded to people at higher risk, and elderly people with pre-existing comorbidities. So actually we have completed over 40 days of vaccination as I speak with you. And we've vaccinated over 100,000 people.
Dr. Ageda,
yes.
Just one moment. In all of this, have there been challenges like disbelief, vaccine hesitancy, misinformation like the claims of magnetic properties of the vaccines?
Yes, those were as expected, of course. There are challenges that you expect with any new thing that comes in, and we had those challenges, sticking challenges, and we've been able to overcome them significantly over time. And that is why you can see that we have exhausted our vaccines. As at this morning, out of the whole vaccines we received, we had less than 200 doses remaining. And as I speak with you now, I'm sure we would have exhausted the last of the vaccines that we had.
My final question to you. Okay, go ahead. Yes. Go ahead, please.
Yes, the challenges we had of rejection, myths that people were spreading about magnetism, about dying within 2 years of taking the vaccine. We were the first people that took the vaccines, and we are here. We had no challenge at all. We have not recorded any serious adverse events following vaccination in this state. We had mild issues of slight pain at the site of injection, a little giddiness, occasionally headache, but we've not had any serious challenge at all. And I think it has encouraged more people to come out for the vaccine, and we've done quite well. We've exhausted what we were given use.
Just before we let you go, I mean, we know that cholera, for example, is, one thing that Benue has been experiencing, especially the rainy season, and then more often in poor sanitation. But is that in any way clouding the COVID-19 response, or vice versa? Very briefly, please.
No. It's not. It's not one of our challenges in terms of clouding or interfering with our level of acceptance of the vaccine. Those are just some other public health challenges that you occasionally find in the system, but we've been able to cope with all of that, and it has never reflected on the acceptability of the vaccine, which we have given in the last 3 months, 3.5 months.
We'd like to thank you, Dr. Bem Ageda, as Executive Secretary, Benue State Primary Healthcare Board. Thank you for joining us on the program.
Thank you very much. My pleasure.
Well, we have more on the COVID-19 update when we return. Please stay with us. And away from Nigeria. So far, and according to the Johns Hopkins Coronavirus Resource Center, China has vaccinated the most with over 1 billion doses of vaccines, followed by India in second place, over 361 million vaccine doses on the nationwide vaccination drive. Now, the government of India says it is committed to accelerating the pace and expanding the scope of COVID-19 vaccination throughout the country, and advanced visibility of vaccine availability to states for enabling better planning and streamlining the vaccine supply chain. Now, from India's Ministry of Health and Family Welfare, and this is its COVID-19 update of today, India reported 43,733 new cases in the last 24 hours. India's active caseload also declined to over 450,000. Active cases continue to constitute about 1.5% of total cases, and over 29 million have recovered so far. We understand that 47,240 patients also recovered during the last 24 hours. Now, a look at India's COVID-19 trajectory shows lots of good news, and that is the daily recoveries continue to outnumber the daily new cases for the 55th consecutive day. Recovery rate increased to 97.18%. The weekly positivity rate remains below 5%, currently at 2.39%. The daily positivity rate at 2.29%, less than 3% for 16 consecutive days. And testing capacity substantially ramped up, 43.33 tests that have been done so far in the country. Well, to take a closer look at the situation in India is a journalist joining us from the country, Nabila Jamal. Thank you for joining us on the program.
Right. Hi. Thank you very much for having me.
Thanks, Nabila. Now, with India among the top countries in the vaccination rollout, is that driving down the infection numbers considerably?
Yes, absolutely. India still, even now as we speak, we're looking at vaccination drives picking pace. It's not as much as what the government hoped to have. In fact, the government was hoping to be vaccinating at least half the population by this time, but that target hasn't yet been achieved. But we're looking at the rate of vaccination increasing by the day. In fact, just the last week, about 90 lakh odd people, in fact, close to 9 million people got vaccinated in a single day. So we are looking at the vaccination rate picking up, and many of the states that have vaccinated their population by and large, at least even 20% of the vaccination drive that's taken place in various states have reported much lower COVID cases in compared to areas that have not been vaccinated. So at least I could say that at least 95% of those who have been vaccinated in India, or rather those who got COVID-19, those people have not been vaccinated. So we're looking at the vaccine really working, and increasing numbers of vaccinations and of people who are getting vaccinated are being safe, and that's sort of rubbing off population at large to get the vaccine in time. But if you ask me, are we satisfied with the pace of the vaccine, currently the vaccination drive? I'd say not as much as what was planned, but we're surely getting there.
But in terms of human behavior, which was one of the things that drove up the numbers in the first place, would you say that now people are taking precautions?
Well, I beg to differ on that. I don't think, I think it's just out of habit or just sheer frustration. The moment the lockdown was lifted in several cities, people got back to business like there was no pandemic. In fact, certain hill stations like Shimla, Manali, these are holiday destinations in India, north of India, we saw lakhs of people going out for a weekend just to enjoy their freedom after months of being locked down at home. And that place was crowded. It was an ocean of people right there, literally crowding, hovering around the market areas, which triggered fears of a third wave. And of course, experts have been warning us of a third wave, even though they've said that it won't be as dangerous or as deadly as the second wave, because we are hoping to have more people vaccinated by then. But yet we can't take this lying low. I feel people aren't showing enough responsibility as they should. Some areas are, some aren't. So, and we're talking about 1.4 billion population, and it's really hard to crack down, for the authorities to crack down on each one of them. It becomes a collective responsibility, but we see a lot of them still lacking it. You have festivals happening in the south of India, like Tamil Nadu. There's a fishing festival that's currently taking place, where thousands of people are currently gathering by the river banks to be part of this annual fishing festival. It was cancelled off the last year. This year, they were allowed to do it, but there were COVID protocols in place. They weren't following it. So what can you do? I mean, at the end of it, we're looking at people showing irresponsible behavior, and that's really triggered fears of a third wave.
So a lot of work for the government. But then finally, we understand that the time frame between the 2 doses for the Covishield AstraZeneca was increased from 6 to 8 weeks to 12 to 16 weeks. What changed?
Well, there was initially reports that suggested by the COVID management committee that said that increasing the time period between the 2 jabs only increased the efficacy rate of the AstraZeneca Covishield. But of course, there were contrary reports also that said that even if you took it 6 weeks apart, it would still have the same effects. But well, there were also speculation that because of a shortage of vaccines, that they could have possibly stretched the period between the 2 doses. But nonetheless, right now, it seems like the period between the 2 doses have been stretched only because of reports that have come in from the Serum Institute of India, from the manufacturer of the vaccine itself, along with the expert committee, who have said that you can wait up to 14 weeks for getting the second jab of the vaccine, because the efficacy rate is better or the same. But nonetheless, we're not being stopped to take it any earlier. It's just that you can wait up to that period.
All right, many thanks,
But yes,
Nabila.
there is a vaccine shortage, and it seems like the government is doing everything to ramp it up.
All right, we appreciate that update. Thank you so much, Nabila, from New Delhi there in India.
Thank you very much.
The United Kingdom has reported over 32,000 new cases of coronavirus today. The first time since January, the daily figure has been more than 30,000. It comes as the country prepares to loosen restrictions even further later this month. Prime Minister Boris Johnson, who is being grilled by MPs today, insists the vaccination program has severed the link between rising cases and deaths, despite his chief scientific advisor saying the relationship had been weakened rather than severed. Here's more on the global update.
The leader of the opposition, Keir Starmer.
There's more from the British Parliament as opposition leader Keir Starmer branded the COVID-19 Delta mutation the Johnson variant after the Prime Minister. Starmer quizzed Boris Johnson today over the government's plans to ease its lockdown restrictions later this month, despite projections of 100,000 coronavirus infections per day. Over in Malaysia, where people are struggling to cope with the lockdown, people hang scraps of white cloth outside their windows in a plea for help. For many neighborhoods, it's been the most effective, especially for people in vulnerable groups. Lockdown in Australia's New South Wales state has been extended as the state warns the new cases of COVID-19 are bound to rise as it grapples with the highly infectious Delta variant. Sydney is fighting its worst outbreak of the year, with another 27 COVID-19 cases reported today. Finally, tens of thousands of Brazilians are out of shelter as the country continues to grapple with the lingering COVID-19 pandemic. As the southern hemisphere is now in winter, the situation of those homeless is deteriorating with a declining temperature. The temperature now at night is as low as 14 degrees Celsius, with rains dripping for most of the time.
Continue to take responsibility. You can see more updates on our website. It has a better understanding of the pandemic and more stories as well on the coronavirus situation. You can find several other stories there as well. Breaking news, it's all at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.